So what is meniscus of knee joint? Where do we find this meniscus inside our knee joint? How this meniscus can be injured? What are the symptoms? How the diagnosis can be done? How you can understand your MRI of your own, and how this meniscus tear is treated. Friends, myself Dr. Vikram Sharma, head sportsmed, Fortis Escort Hospital, Jaipur, and in this video we are going to talk about all these topics in a brief. So first of all, we need to understand the normal structure or the anatomy of knee joint. Friends, this is the knee joint, this is the thigh bone, we call it femur, the lower bone or the leg bone is the tibia, and these are two C-shaped structure, we call them meniscus. So we have two meniscus in our joint. The inside meniscus is called medial meniscus, or the meniscus which is lying on the outside of our knee joint is called the lateral meniscus. So we have two meniscus in each of our knee joint. Friends, meniscus plays a very important role in our knee joint. Meniscus acts as like a cushion or a shock absorber. So whenever any extra force comes to our knee joint, this meniscus or the cushion of the knee is a very important structure to absorb this extra force which is transferred to the meniscus. So this meniscus is like a protector of our knee joint. Apart from working as a protector, this meniscus also works supplying as a nutrition or distributing nutrition to our knee joint. Friends, we have a synovial fluid inside our knee joint. This fluid is very important to provide nutrition to this cartilage, which is a smooth, glistening structure over both the bones. So this meniscus helps in redistributing this synovial fluid equally to the knee joint. So in this way, meniscus is a very important structure which helps us to work as a protector of knee joint, as a shock absorber, as well as for the specific nutrition of our knee joint. Further, moving in this video, we'll try to understand how this meniscus can be injured. So the typical meniscus injury mechanism is twisting injury over the knee joint. So friends, whenever there is a twisting force, like your foot is fixed on the ground and your body is twisting this way, so this meniscus gets entrapped within both these bones, and there is definite chances of rupturing the meniscus. So any kind of twisting injury can lead to meniscus injury. Now we need to understand what can be the symptoms of this meniscus injury. Friends, symptoms of the meniscus injury depends on its grading or its severity. If this is grade 1 or grade 2, there will not be many specific symptoms. But if this is grade 2 and grade 3, in further moving with the video, we are also going to talk about how this grading can be done. But at this point of time, we need to understand that in cases of grade 3 and grade 4, the patient can feel a kind of snap or click inside the joint. In severe cases where the meniscus is injured as a grade 3 and grade 4, there can be a frank locking. Friends, locking means whenever you try to extend or flex your knee, that means whenever you try to bend or straighten the knee, you may feel a locking sort of thing. That means something has got stuck inside your knee joint, and that thing is sticking that badly that you are unable to extend or flex your knee joint. So this symptom is called as locking. Friends, at this point of time, you also need to understand that there is a difference in the stiffness and locking. Stiffness means whenever you try to straighten or flex or bend your knee, you may find a mild pain or difficulty. This symptom is known as stiffness, whereas locking means you feel that something got badly stuck inside your knee joint. So if specifically in a young age patient you feel something is sticking inside your knee joint, typically occurring immediately after injury or sometimes after injury, you should always be thinking of a meniscal injury and you should definitely consult to your doctor. So till now in this video, we could understand where this meniscus lies in your body, how this meniscus can be injured, and what are the frank symptoms of this meniscus injury. Friends, also you need to understand in cases of chronic cases, means whenever this meniscus injury is very old, say 1 year or 2 year, a degeneration of the joint start to develop. That means this torn meniscus start to create a wear and tear of this cartilage, which is a protective smooth covering of the bones, and this can lead to osteoarthritis of knee joint. That means your knee joint started to get degenerated, gets damaged in even a young age. So in cases of chronic cases, there can be a swelling, there can be a continuous pain on your knee joint. So these are the symptoms of any kind of meniscus injury. Further moving ahead, we need to understand how your doctor can diagnose this meniscus injury. So whenever you go to your doctor, first of all, your doctor examine your knee with some of the clinical tests. We call them McMurray's test or the Apley's test. These are specific medical tests by which, in case these tests are positive, your doctor can suspect a meniscus injury. If there is a suspect of meniscus injury, your doctor will send you to the MRI, and on the basis of MRI is definitely a gold standard to diagnose the meniscus injury. And in cases of such meniscus injury, your MRI can clearly narrate the grading of that injury. That means how much your meniscus is torn. So we have earlier also talked about grade 1, grade 2, grade 3 and grade 4. What do we mean in reference of a MRI? So if your MRI says this is a grade 1 injury, no need to worry. That means there is a very mild injury, only swelling inside your meniscus, and this can be treated with the help of a physiotherapy and some of the medications. If this is grade 2 and you don't have any symptoms, like you don't have any symptoms of clicking or snap inside your knee joint, again this condition can be treated with the help of some of the physiotherapy and medication. If this is a grade 3 injury, that means meniscus is torn and this is coming out. That means the tear is coming out, it leaving its own natural place, and there would be a frank symptom of snap or click inside your knee joint. Friends, this grade 3 injury is definitely a surgical indication. In cases where your MRI is saying grade 3 injury, you should almost always consult your doctor, and the remedy would be surgical meniscus repair of this torn meniscus. If your MRI is saying this is a grade 4 tear or a bucket handle tear, friends, this is definitely a much concerned matter. That means you require an immediate surgery, and in these cases you should not linger on this injury, and you should definitely connect to your doctor immediately, because if you do not get this condition, specifically grade 3 and grade 4 meniscus injury treated, there may be permanent damages to your knee joint as well as to your meniscus, and the repair of meniscus would be difficult in cases of chronic cases. Apart from this, there are certain more terms which are used in your MRI which you need to understand. Friends, there are different parts of your meniscus. Your MRI may say a root tear. Root means we have two roots. One lies anterior, means in the forward. One may lies posterior. So we have two roots. One is anterior, one is posterior. This part is known as the body of meniscus. This is known as anterior horn. This is the front portion of our knee joint. So this is the anterior horn and anterior part, body of our meniscus. This is posterior root and posterior horn. So these are anatomical terms which you can understand to understand your MRI in a better way. Friends, before moving ahead in the video, I would like to also tell you about our specific WhatsApp helpline. We have a WhatsApp helpline 958707744, and by sending your MRI report on these numbers, you can avail our complimentary advice on your meniscus injury. So if you sustain any kind of these injury, no need to worry about that. Just send your MRI to us on our WhatsApp helpline, and our expert team is definitely going to come back on your knee injury to advise you the best. So till now we have understood that where this meniscus lies in our body. We have two meniscus, how this meniscus can be injured, how we can diagnose, how we can understand our MRI in terms of medical terms. Moving further ahead, I have already talked to you about the treatment methods of this meniscus injury. I'll talk to you about the surgical treatment of this meniscus injury, which lies in the grade 3 and grade 4. We have different techniques of that meniscus repair. We call them all inside, inside out, and outside in. So friends, if you understand, this is the posterior or the back part of knee joint, and all the blood vessels and nerves lies on this posterior part of knee joint. So to repair this part of meniscus, we have to go from the front, and this technique is known as all inside. All inside means we do repair in a inside way. We do not open the joint from the back. So this technique is known as all inside, and we use very specific implant which are made of buttons and fibers, and with the help of these all inside implant we can repair the posterior part or the back part of the meniscus. If the tear lies in this body or the middle part of meniscus, the technique is known as inside out. This is again a very good technique, and the advantage is very firm fixation, and the costing is very less because we are just going to use the specific sutures with the specific needles. We place the needle from inside and we take it out, and we place some stitches on this part. So this is again a very effective technique, or rather very cost effective technique of repairing the meniscus. Similarly, if the tear is on the front part of meniscus, the technique is known as outside in, and we use similar fibers. Again, this is a very cost effective technique. Friends, in cases of grade 1 and grade 2 tear, some of the physiotherapy like strengthening the quadriceps muscle can help you, and in cases of grade 2 injury, a PRP along with the strengthening can be used. So in this video we have tried to understand where our meniscus lies, what can be the symptoms of our meniscus injury, how this meniscus injury can be diagnosed, what are the treatment methods, and what are the advancements. So if we talk about the advancement, I have already told you about meniscus advanced repair techniques. Friends, in the previous time, the procedure has to be meniscus excision, like the torn meniscus was used to excised. But with the advancement of technique, the chances of meniscus repair are very bright. With the help of all these implants and repair techniques, PRPs and specific methods, specific endovision system, surgical expertise, 95% of the meniscus can be repaired. At the end of video, I would also like to tell you about our WhatsApp helpline 958707744. So if you have any similar injury or any kind of a sports injury, you can approach us by sending report of your MRI to this our WhatsApp helpline. So friends, myself Dr. Vikram Sharma signing out. Stay healthy, stay happy. Thank you.